Okay, hi Robert, it's Dr. Buford. We're just getting a little more slack here. We're just getting started on the right shoulder. We're looking in from the back to the front. That shaver you see coming in is coming in from the front of your shoulder. Your biceps tendon's on the left, and your rotator cuff is torn right here. So we're going to get a rotator cuff anchor open. And what we're going to assess right now is whether or not we're going to do anything for the biceps. And I think we will. So we'll get a free hi-fi suture and a shuttle relay and do the biceps tenodesis as well. Here's how we start to work that. And now what we're going to do is take a spinal needle and pass right through the tendon here. So there's one pass through the tendon. We're going to take a shuttle relay, and then we'll take a hi-fi suture. Pull the relay out of that. Grasper. Right. So here's the grasper coming in. Hold the camera here, please. And that black wire you see, that's what we call a shuttle relay or a super shuttle. We'll back out the needle here. We'll go ahead and load this with a suture, our hi-fi suture. I need a hi-fi suture for this biceps tenodesis. Okay. Okay, hold the camera here, please. Okay, careful here. It doesn't want to go anywhere but right there. Okay. That's going to be hard. That's better. Piece of cake. All right, so there we go. We have our second needle in. Hold the camera there. And we're going to go ahead and load the relay a second time. We'll take the grasper again. Now this time we're going to feed a bunch of this relay into position. Okay. We will retrieve the relay, back the needle out, and now this time we're going to let go of the relay, and we're going to bring this around behind just like that. And that's going to give us a bit of a stronger stitch around the biceps in addition to being through the biceps. So if you keep watching on the screen, you can just see that stitch going all the way down and around. So here you go there. And so now when we pull tight on that, see how that gives us a real strong bite on the biceps. We'll take a pair of scissors next, arthroscopic scissors. And we'll carefully cut way down low here. Pause, please. Pause. Okay, so we've got the biceps released. We're just cleaning up the labrum a little bit. We'll pull tight on the bicep sutures for me right here. When we pull on the biceps, you can see the edge of it there. That looks good. Now here's the rotator cuff tear right here. So we can do our preliminary debridement just by bringing the shaver in this position right here. It's a complete tear. You can see we're looking up into the subacromial space at the top of the screen there. But by working from inside the joint here, we can get right at the articular margin and make sure that we've got this ready to go once we change positions with your shoulder in a second here. So that now looks pretty good underneath. There's the tear. We'll have a look around the rest of the joint before we leave here. Sorry. And make sure there's nothing else to do. This is the posterior joint. Posterior labrum looks pretty good. You have some wear and tear changes, but nothing bad. Anterior joint. That anatomy's checking out fine. And that's the biceps. So we will change positions with your shoulder in just a second here. Okay, so here's the tear in the rotator cuff from the top down. Hold those other sutures tight, please. So you can see the damage looks worse from the bursal side looking down than it did from the articular side looking up. There's some of our bicep sutures there. That's why we hold them snug. Okay, and next we will get to work on placing a suture anchor down here. Before we do that, I do want, hold the camera here, I do want to look from the front to the back with the shaver just to make sure that there's nothing unexpected on this posterior aspect of the tear. So we're going to push in here and lift up and see what is going on towards the back. So there we can see where the tendon's reattaching to the bone. It's a little bit more torn on the deeper layer than it is on the superficial layer, and that's pretty typical. But we will repair all of this down to the bone here. Okay, so we'll show you some more in just a minute, but here's the hole in the tendon. That's what we're going to be fixing. Hold the camera. Okay, so here's the way that we tell where we're going to place our anchor. We're going to place our anchor pretty close to the articular margin, which is right here, maybe back just a couple millimeters. Hold the camera there. So next you'll see a metal tube come down. That's our guide. There it is there. And so we'll place this guide exactly where we'd like to have the anchor go down, which is right about here. Go ahead and pull it. Pull that. Okay, 2 hands on this when you get a chance. And I think we're going to take this down to the bone right about here. And you can see that this particular anchor has 3 different sutures attached to it, and that is a very strong hold on the bone. We'll take a crochet hook next, and we'll take some of these sutures out one at a time and start passing them through the tendon. It looks like the first one that we'd like to work with is maybe this blue, or the blue and white striped. Let's see how that looks. Yeah, we can work with the blue and white stripe. That's not a problem. Get the rest of these out of the way. And we'll show you some more in just a minute. Okay, take that out, put a grasper in the front. Let me see the... Okay, so we've got all 3 sutures passed. We spread them out pretty much as we can. So here's the posterior one, middle one, there's the anterior. We're going to start tying from posterior to anterior, so we're going to start with that blue and white striped, and we'll go off on the video and show you. There's the hole, just to give you an idea of how that's looking there. Okay, so we're going to close down that hole right there. Okay, hold the camera. Okay, so we're done with the repair and the biceps tenodesis. You can see the 3 sutures are tied there. That looks very good. I am going to make a little hole in the bone there. I'm going to look at the bone up above. We've already done a little bit of a decompression. I don't think we have to do any more there, so that's good news. And we've also tied the biceps tendon suture, which is that one right there for the tenodesis. So one of the other things I like to do to release some of the healing factors and some of the stem cells in the bone is to make a little bone marrow vent. We're going to make 2 of them here for this size tear. One there, all the way down. All the way down. Okay, there's one. So the bone marrow lives inside the greater tuberosity here, and that is involved in the healing process along with a lot of the proteins and other growth factors that are in the bone marrow. And there's even some stem cells that make a lot of those same healing factors. Go one more. Yeah, great. Okay. Okay, so with those 2 holes, as I turn down the pressure on the pump, what you'll see is some of the bone marrow start to come out. And over the course of the next few hours, we'll get a lot of that into this area to start the healing process. So the pressure's way down. We can help by turning off the pump. And then you see here, see how the yellow marrow elements start to come out. It looks like little fat droplets, but there's a lot in there that you can't see. So we're going to finish up here, and we'll get you back to the recovery room shortly. Good luck to you now. Bye-bye.